I'm an internist and diabetologist and been doing clinical work for more than 40 years and still doing. And most of my time is today with diabetic foot problems and talking about those things more tomorrow. We have done some research with expenses of diabetic foot problems. I'll show you one of those papers. Paper was published just a few days ago. But some background information. Diabetic foot syndrome or diabetic foot problem is the most common complication of diabetes. This is coming from the textbooks. It affects about 30 to 60% of people with diabetes. So everybody who is taking care of diabetic patients meets this problem. The whole picture, the whole problem is, or the term is diabetic foot syndrome. And there is muscular problems, neurological problems, sarcot foot, wounds, and so on. And early intervention is essential to reduce that diabetic foot syndrome and amputation finally. That's our aim. I just got some information or like to show you some statistics of the incidence of like diabetes or some chronic diseases. And if you look at this leftmost panel, during last year there was 16% less new diabetes diagnosis in Finland, and the same finding is published from UK and Italy and many countries. So the coronavirus situation have hidden diabetics, and eventually we will see more complications and problems, and that's what we think. So this is not a real finding that diabetes is disappearing. Diabetic foot syndrome, most of the patients have problems with the sensation of pain. The LOPS comes from loss of protective sensation, and that's the major problem for wounds and also sarcot foot and consequences of traumas. Arterial disease is something between 10 to 30% of these patients have, and foot ulcer gets about 2 to 5% of diabetic yearly, and about 25% during lifetime. One of the major problems is the recurrence of the wounds. And we have insufficient methods for primary prevention, a little bit better for the recurrence, but there are still much work we should do. There are several risk factors what we can identify. These are some statistics, or epidemiological statistics from international sites. This is FU and companies did an analysis of literature, how diabetic foot, so it's the epidemiology in different continents and different countries. The globally highest is in Turkey. We do not exactly know what is the rate in Finland. Also the diabetic foot problem, its average number of these published papers is that it's about 6% of the diabetic patients have diabetic problems. Also, this figure exactly we don't know what the prevalence is in Finland. We know from some hospitals and some areas, but not from the whole country. Then there's a couple of papers published recently. One is rate of amputation. This is like 20 years. What has happened during last 20 years, and there are the color signs here at the bottom of this slide. And the major finding is that the small amputations it's increasing, but the ankle amputation rate is decreasing. And if you look like vascular problems, this red line shows how much vascular procedures have been done, bypass surgeries or angioplasties, so on. It's substantially increasing from year 2008 and increasing all the time, but there is very small change in the rate of amputations. So that there is also a lot of work what we should do and other things what we should do. This is just the same picture from our own hospital region. It's about a million population, and it's very similar as this previous one from the whole country. Then there's another picture that who are those patients who benefit most from vascular interventions, and this is divided by the age of the patients, and most of the procedures are done for quite old individuals of the age of 85, and then also only the old ones, or older than 85, they get most benefit from the procedure. Only with the younger one, there is no real change during 20 years. Then some other statistics. This is a survival rate of people who have been done amputation, and this white part is those who do not survive. So during the first month, about 25% are dying. During 1 year, almost half are dying, and during 5 years, about 75% are dying. So only 23% survive 5 years. Different amputations, different level. David Armstrong published some couple of years ago. He compared 5-year survival of amputation patients to cancers. And as you can see here is a 5-year survival of breast cancer, and the right panel is lung cancer. So major amputation is almost as bad disease as lung cancer, if you think the survival. This slide is from IVCDF publication, and she goes with us last time 3 years ago. There are some key elements what we should do to improve the situation and improve the survival of the diabetic patients. And this was the background epidemiology, and then I saw some of our own results. Only one paper. We tried to estimate the expenses and what the diabetic complications have in the Finnish population. This is published just a couple of weeks ago, and an open site, so everyone can get the paper. We had some background information about what are the expenses. I'm not going in details with these. The aim of our study was to define typical care pathway of diabetic foot complication, to locate it from the databases or the discharge registries, and to calculate how much these patients are using our healthcare system and resources, and what are the costs. From those registries, we cannot get the social expenses, and those are missing from our calculation. And the population is all diabetics from 1964 until 2017. So almost 900,000 diabetic patients. And discharge registry, so we have the background information for a long time, and the discharge registry was used between 5 years, from 2011 until 2016, and we located foot complications, and there was almost 64,000 hospital periods during that time. And then after 2016, we followed each individual for 1 year, what is happening and what is the outcome during 1 year, and used this hierarchical clustering algorithm system, ward method. I'm going in details, and to be honest, I'm not very familiar with this, because statisticians were doing it. We divided these patients we gave some name for the group, like infection or vascular problem or dermal problem, using the ICD codes. And then we have some comorbid conditions which we also took into the database. And all these patients had to have one of these ICD codes on the hospital discharge registry. Not going into detail on this, there are some smaller number of patients, but in some cases quite many 15,000 or so groups. And these are the outcomes. So the dermal, if it's the diagnosis is categorized to letters starting with L or S, that is the most expensive group, and most patients are going to this area. And this is because of these patients need several. They have to come to hospital or outpatient clinic several times for a long time period. That gathers expenses. And some like orthopedic or infectious complications are quite inexpensive, because this usually happens only once, and the treatment is possible to keep in one occasion. And the total expenses what we calculated is about 70 million euros for diabetic foot complication. Most of the expenses are coming from specialized care, hospital and outpatient special care, not from the health centers. And we also compare, in this paper, we compared it to some published data. I took only the UK data here. So we calculated that about 1.6% of total diabetes-related costs are coming from food problem. From UK, it's been published that it's about 0.8 to 0.9%, so it's pretty similar, a little higher what we got. Individual costs vary a lot, and it depends. Do the patients need several visits, several hospital treatment periods, and so on. There's at least tenfold difference between different patients during 1 year, and about the same numbers. The expenses number has been published from UK. But this is the background what I was going to show, and now we can discuss now or later.